Thank you, Mr. Chairman. I want to thank all of the witnesses for joining us today, for your patience. I know it's been a long day. Americans are suffering from an affordability crisis, and nowhere is that felt more acutely than in families' health care spending. Since President Trump took office and Republicans took control of both the House and the Senate, American workers and their families have seen their health care decimated. Just 202 days ago, Republicans passed H.R. 1, cutting out $1 trillion in health care spending in Medicaid, the Children's Health Insurance Program, Medicare. All these things were cut. Just 22 days ago, Republicans allowed the Affordable Care Act premium tax credits to expire, causing people's health care premiums to go up by hundreds and even thousands of dollars a month, nationally an average of 114%. Just 17 days ago, Secretary Kennedy reduced the number of vaccines routinely recommended for all children from ages 17 to 11. This adds an additional hurdle for parents to protect their children from deadly diseases. A decision not based on science, but driven by politics and wacky conspiracy theories, all at the expense of our children. Today, we're here to discuss the rising cost of health care for everyone. I have a lot of questions for our panelists, but I want to start with a few rhetorical questions for my colleagues. How does implementing new layers of administrative red tape designed to keep low-income Americans off Medicaid lower the cost of health care? How does ending the premium subsidies for individuals buying insurance through the ACA marketplace lower the cost of health care? How does cutting dollars used to serve older Americans in long-term care settings lower the cost of health care? How does letting children get sick or even die from preventable diseases like measles by endorsing removal of medically proven vaccines lower the cost of health care? Here's what I know. Policies that mean more uninsured people also mean more uncompensated care, less primary care, and people's insurance premiums skyrocketing for everyone who is fortunate enough to even have insurance. A sick or unvaccinated population leads to more kids in emergency rooms and more expensive medical bills for the average American family, bills that many just simply cannot afford. Here's what else I know. Republican action this Congress has been instrumental in manufacturing the affordability crisis, from groceries to housing and, yes, to health care. So my question for the group here, the CEOs, and this is a yes-no question, do cuts in Medicaid and the expected loss of people losing their insurance, will that contribute to rising insurance premiums? Mr. Hensley. Will the fact that 10 million people are going to lose their insurance because of cuts to Medicaid, will that lead to broad increases in health insurance premiums in the broader market?
It will not. The costs will continue to rise.
No, is the fact that there's more uninsured, more uncovered care lead to premiums for those who have insurance to go up?
Costs will create more cost in the system that will have to be addressed, yes.
Okay. Mr. Joyner.
Yeah, assuming they move to an uninsured position, then yes, premiums will go up.
Ms. Bordeaux.
I don't think it's quite as simple as just that, because I think there are a number of scenarios. If they go to uncompensated care, it will drive up costs. They also have opportunities to go into the ACA.
But yes or no, will more uncompensated care lead to higher premiums for the rest of us?
Uncompensated care does drive costs up.
Mr. Markovich. I'm sorry,
yes, I believe it will.
And Mr. Kandani, I skipped you, I'm sorry.
More uncompensated care will make its way through the system in elevated cost.
And real briefly, will more kids having measles or other preventable diseases being treated at a cost far more than the cost of a vaccine lead to higher healthcare costs and higher premiums? Mr. Helmsley.
Yes, higher disease levels will.
Okay, Mr. Joyner.
Yes.
Ms. Boudreau.
Prevention is always better, yes.
Ms. Cordani.
Yes.
Mr. Cordani. Mr. Markovich.
Yes.
All right. So we've heard that my colleague on the other side said government-driven healthcare inflation. The policies we have seen this year is driving healthcare inflation up. I have behind me a chart that shows the increase in measles in the last year. We are seeing an increase from 2 years ago, 2023, of 59 cases of measles in the United States, 285 in 2024, and last year, 2,242 cases. And the average cost for the insurance companies to pay for a measles vaccine is about $100. And the average cost to the country to communities to take care of one child with measles averages $40,000 or more. And whenever there's an epidemic, the cost to the community to deal with that case of measles, to deal with making sure it doesn't spread, can be as much as $250,000 fixed cost. These are the impacts of the policies that are being passed by this Congress, the Republicans, in the last year. And if we want to address healthcare costs, we need to work together. We need to make sure costs go down for all Americans. More people have access to quality care, access to the health insurance, and can see a doctor when they need it, wherever they are. I yield back.
Ms. Fischbach.